Hey guys, Dr. Jeff Finley here.
And Dr. Jessica Finley.
And this week we are answering a viewer question on inversion tables. Inversion tables involve a sort of traction, and so we have a couple of articles that look at what the research says about traction. Now this first article is a systemic review of the literature, meaning it's looking at all of the research that's been published up until this point and what it has to say about this specific topic, which is traction. Now, it has a lot more in this article because it was looking at therapies for the low back pain. So it has anything from medication, over-the-counter medication, yoga, tai chi, spinal adjustments, physical therapy, so on and so forth. But for the focus of our video, we're going to talk about the aspect that focused on mechanical traction.
All right, so what is mechanical traction? You're laying on a table that eventually you get strapped in, and it creates a long axis pull, similar to someone lifting up on your head or even just pulling on your leg. Despite all of the review of the literature that we've found, there has been no benefit to slight benefit of the use of mechanical traction along with physical therapy or some other type of rehab. The mechanical traction on its own is not going to be beneficial. So, one thing that the literature has found that there is benefits of it being low risk compared to some other options that are out there.
So this is good. If there's little to no benefit, that means that there's a chance that you can benefit from this with relatively low risk compared to medications or some other type of therapy that may have higher side effects, higher risks of complications afterwards. So still something to keep in mind, which brings us to the next point. Even though the literature does not really support the use of mechanical traction, while we want to be evidence-based, we do not want to be evidence-limited. We're looking for what makes the patient better. And as we found in our own personal practice, many patients have benefited from some sort of mechanical traction or inversion therapy, something that allows traction to take place, and that's all that matters. So as long as you're seeing benefit from it with relatively low risk, it's worth giving a try.
So let's talk about this other study. So we're going to talk about the use of inversion therapy with physical therapy. We have two groups of people. There's 26 participants, which is a pretty small size, but that's okay. They were divided into two groups. One group was doing inversion therapy along with physical therapy. The other group was just doing physical therapy alone. Now, I should also state that all of these participants were scheduled for surgery. So what were the results? The group who did inversion therapy along with physical therapy, 77% of them didn't have to have surgery. On the other hand, the group who did physical therapy alone, only 22% of them didn't have to get surgery. Now, this is a small group, like I had mentioned before, so there is no huge, we would like to see more studies done on this. However, it's pretty incredible to say that inversion therapy or the inversion table could be beneficial, but you should be doing some other type of therapy along with it.
So what's our takeaway from all of this? Is traction inversion tables helpful? Well, the answer is it depends. There's very mixed reviews on the effectiveness of this. But again, like we've said, we've seen it personally benefit many people. So our advice, if you're looking to try it out, see what happens. Try it for a short period of time, maybe a couple weeks, and see what you find. If you don't feel any different, it may not be the right therapy for you. If you certainly get worse, that is definitely not the therapy for you. But if you find benefit to it, keep working with it. But we would also advise that you're doing some other form of therapy with it, whether that be strength training, whether that be physical therapy, whether that be chiropractic. Add in some other form of rehab with that to find the maximum benefit for you and your condition or issues. So as always, if you found this video interesting, go ahead and give it a thumbs up. We always like to know what you're looking for and information from us, so be sure and make a comment below and share this video with someone you may know that has issues with their back or is curious about an inversion table. Go ahead and share that with them. Thanks for tuning in, and we'll talk to you next week.